I am ready for some questions. We have about 10 minutes. Yes, ma'am. And I'm going to repeat the questions so that you'll all be able to hear. Please.
Under bunion surgery, what is the, how long does it take and how long does it take to recover? Because I see, people walking around with those scooter things with their
Yes.
feet on them.
The young lady asked, what is the postoperative care generally and what is involved with bunion surgery? That's a great question. The answer is we never want our patients on scooters. We always want them walking on their own 2 feet. When you're walking, your circulation is moving. Again, the organization that promotes these procedures is called the Academy of Ambulatory Foot Surgery. So we like our patients to walk. The normal course after bunion surgery is the patients wear a surgical shoe like this for 3 weeks. They come back once a week for dressing changes, etc. When they hit the 3rd week mark, they can get out of the surgical shoe. They don't need to use the shower boot anymore because not only can they get their foot wet, we ask them to soak their foot in water with a little white vinegar. It has a very healing, soothing effect. And we ask them to put a little 1-inch tape wrap around their foot and wear a little 1/4-inch toe spacer in between the 1st and 2nd toes. They're back in their shoes at that time, and they do the self-taping and use of the spacer for 4 weeks. So you're at 7 weeks and usually out of everything. Does that answer your question? Can I wear high heels? Oh, can you? I'm just kidding. So the answer is that once patients heal completely, usually about 3 months, can go back to high heels again. Yes. Yes, ma'am.
I was just wondering if it's advisable to have both feet done at the same time.
That's a great question, and most of you probably heard this. The question was, is it advisable to do both feet at the same time? I will tell you that for many years, when we first started doing these procedures, certainly through the 80s into the 90s, the doctors were afraid of doing both feet at one time. And then what happened in my practice, as well as many of my colleagues, is patients tend to travel to our offices for these procedures from all over the world. Those patients are limited as to the amount of time that they could spend in an area getting their feet corrected. So we started offering bilateral or both feet surgery at the same time. And you know what we learned? We found out that the only thing that stopped us from doing it was our own fear, because the patients did great. So there is no right or wrong, but you can absolutely, for instance, if you're considering bunion surgery or hammer toe surgery, you can absolutely do both feet at the same time now if you would like to. But if you don't want to, you'd rather do one at a time, that's perfectly acceptable.
How long should you wait if you decide you're going to do one and then come back and do the other?
Yeah, that's a great question. So the question is, if you're thinking about doing your feet separately, how long should you wait? And again, it's your own individual desire. From a medical standpoint, there is no right or wrong. Okay? We know now that people can do well having both feet done at once, so certainly if they want to wait a week or two and do the other one, that's perfectly fine. Sir?
Yes, pain on the bottom of the ball of the foot, is that typically caused by Morton's neuroma?
The question was, is pain on the ball of the foot caused by Morton's neuroma typically? And the answer is that it could be, but it could be, and more likely is that plantar flexion of the metatarsals that causes the calluses and the pain, etc. The other thing that lends itself to pain on the bottom of the foot often, sir, is the fact that after age 18 approximately, all of us start losing cushioning and padding on the balls of our feet. And we develop what's called fat pad atrophy. So we actually even have tried experiments where we have injected the fillers that plastic surgeons use in the face, like collagen, in the bottoms of the feet. And what we learned the hard way is that it lasts longer in the face because people don't walk on their face. So on feet, it wears out very quickly, so it's not advisable. So I agree with you that Morton's neuroma could be a cause, but there are many other causes on the bottom of the foot, and there is never any substitute for, obviously, a medical history, an examination, an x-ray to find out what is the cause in your case. Yes, sir.
If you use the laser technique to get rid of the toe fungus,
Yes.
what's the recurrence on it? Does it keep coming back and you keep lasering it your entire life? I had a friend say you'll never get rid of it.
Yeah, that is a great question. So the question is, once you get rid of the nail fungus and you're still in Central Florida and there's still heat and humidity here and you're still going in shoes, what is going to stop it from coming back? The answer that I have found is it possible for it to come back? Obviously, it's always possible. What I have my patients do, along with the use of the laser, is I have them use a topical antifungal medication during the time that they're being treated with the laser. Now, what I also do is once the laser treatments are concluded, I have my patients use that topical medication once a week, forever, okay? That has an excellent chance of stopping it from coming back. So that's the thing that's changed. For those ladies that like to paint their nails with a polish, there is a brand new product out called Claris Nail Polish Enhancer. And what they actually can do with this is they put a couple drops of this medicine in their nail polish bottle, and it turns their nail polish into being not only nail polish, but being a topical antifungal. So, and that's only been out for a month or so. So my experience has been generally the topical medications tend, for a reason that I can explain to you that'll take more time, tend not to cure the nail fungus in and of themselves. But if we can cure it with a laser, we can cure most of them, then using the topical once a week will usually keep it from coming back. Yes, sir, thank you. Please.
My heel about 2 weeks ago started hurting, and it still hurts off and on, and the only thing I've done is support and lidocaine, I believe it's called, which doesn't seem to do much, and that's where I am.
Okay, sir. So the question was, the gentleman says he's had heel pain for several weeks. He's not sure what the cause is. He has tried some arch supports. He's tried the lidocaine patches. I will tell you that there is so much tissue in between the skin and the fascia that those lidocaine patches are not getting in through all the layers of soft tissue. I do like the idea of arch supports initially, but the first thing that I want to know when I see a patient or someone asking about their heel pain is, I want to know what phase of heel pain they're in again. I want to know if it's plantar fasciitis only. I want to know if they have a heel spur. I want to know if they have congestion. So again, I agree. I don't think the lidocaine patch will be of much good. I like the idea of the arch support. If you would like to try, I don't know about your medical history, if you can safely take anti-inflammatory medicine, you can go ahead and try some of that as well. But again, one of the reasons we offer the free exams is there's never a substitute for having an accurate diagnosis before you start treatment. I'm sorry? Yes, but there are some contraindications to ibuprofen, and it does react with some medications. So I advise, before you take it, check with me or a doctor as to what medications you're taking currently. I think we are out of time. Thank you so much for coming.